This is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our course, patient safety, according to multi-professional curriculum designed by WHO. This session 2 is about human factors. Learning objectives: define the term human factors, discuss the relation of human factors to patient safety, apply human factor thinking to work environment. When you are in unfamiliar place, you might not function well. Imagine that you are a user of iPhone or Samsung, but you have your brother or sister using the other brand, and he asks you to send a message or to send a phone number from his phone which you are not familiar with. I bet you're gonna experience some difficulty. Look, the way we make our coffee or tea. Everybody use a different way and different machines and equipment, and even the amount of coffee and other flavor we add. So there are different ways of making things. But when it comes to workplace, it is better to standardize so that everybody do the same thing in the same way. As I mentioned in session 1, medical errors and patient harm are very common. It can affect almost 10% of the patients. The traditional approach to human error might be called perfectibility. Perfectibility model that assume that if workers care enough, work hard enough, are sufficiently well trained, error will be avoided. But the reality is that we acquire information from the world around us through different senses and through different tool and media. Then we process them, we interpret them to make sense. After that, we design a response and then we execute this response. Error can occur at each steps in this process: during perception, during interpretation, during response, and then we will have different outcomes. Human factors or ergonomics: the study of all factors that make it easier to do the work in the right way. It applies wherever humans work. The science of human factor, it cover the understanding the properties of human capability, the application of this understanding to the design, development, and deployment of system and services, and the art of ensuring successful application of human factor principle in work environment. The term human factor or ergonomics are used to describe the interaction between individuals at work, the task at hand, and workplace itself. This science depends on many disciplines like anatomy, physiology, physics, biomechanics, and psychology. A simple definition of human factors is the study of the interrelationship between human and the tool and equipment they are using in their work environment. The application of human factors is well known in aviation, in nuclear plant, and military, and it helps to improve the work process and reduce hazards and injuries. Only recently been acknowledged as an essential part of patient safety. A major contributor, this human factor, when it is utilized, it can contribute to reduce adverse event and improve the likelihood of doing the correct work. So in short, human factors is to design environment in workplace and design equipment to fit human capabilities and limitation. Make it easier for the workers to get the work done the right way. This way we can decrease the likelihood of errors from occurring. The science of human factors acknowledges the universal nature of human fallibility, the inevitability of errors. Assume that errors will occur all the time. So then we design things in the workplace to try to minimize the likelihood of error or its consequences. We as human beings, we cope quite well with complexity. Healthcare workers are quite good at compensating for some of the complex and unclear design of some aspect of the workplace, if it is related to equipment or physical layout. Because our brain is very powerful, very flexible, good at finding shortcuts, and they can find them very fast. They are good at filtering information and good at making sense of the things. But in spite of all that, sometimes our brain is making error, and sometimes are very silly errors. Regardless of their experience, intelligence, motivation, or vigilance, people make mistakes. If we reflect in ourselves, we will discover a lot of error and mistake we are doing every day. The problem with us as healthcare provider, when errors occur in workplace, the consequence can be a problem for the patient. This is a unique situation related to healthcare delivery. As human beings, we can misperceive situation despite the best of our intention. In some situation, we don't get it right. If you look on the chart at the chart on the right side, and if I ask you to say the color of the word, not the word itself, try to count how many mistakes you are doing. After you finish, look at the chart on the left side and try to figure out if the lines are straight or they are crooked. This tells you about misperception. Error is the inevitable downside of having a brain. One definition of human error is human nature. Definition of error: failure of planned action to achieve its intended outcome. A deviation between what was actually done and what should be done. And simple and easy definition: doing the wrong thing when meaning to do the right thing. There are some situations and factors that increase our tendency to make errors. We can tell this is a high risk situation when we are unfamiliar with a task, when we don't have the required experience, when there is pressure of time, when we don't do adequate checking, poor procedures, poor human equipment interface. In addition to the situation factor, there are individual factors that predispose to errors. Limited memory capacity, which can further be reduced by fatigue and tiredness, stress, hunger, illness, language and cultural factor, and hazardous attitude. Fatigue is a very strong contributor. 24-hour sleep deprivation has performance effects similar to blood alcohol level of 0.1. With that level, you are not supposed to drive. Imagine you are doing patient assessment or even a procedure. As human beings, stress, appropriate and moderate stress are very good, and this is put us in the area of optimum performance. But when we are exposed to low stress or burden or high stress, which lead to anxiety and attack, then our performance will drop. Always remember your individual human factor. When you are hungry, angry, late or tired, halt. This increase your tendency of error and poor performance. In aviation, they use this checklist: I am safe, indicating that I am free of any illness. I am not in any medication that impair my consciousness on ability to concentrate, no stress, not in alcohol or drug influence. I am not fatigued or in any emotional distress. This checklist, it helps you to assess yourself before getting into critical performance. Applying human factors in your work environment, avoid reliance on memory, make things visible. I'm sure recall when you go to a hotel, you see that the coffee machine, it explains how you will make your coffee. Let us make it very visible and simple for our staff in hospital. Ward and clinic equipment should have picture and notice about the steps involved in switching this device on and off. When you are using infusion pump or automated blood pressure machine, just have a simple diagram indicate how we can use these devices. Applying human factors in workplace and environment, try to simplify process. Simple is better. This statement applies to all walks of life, including healthcare. For example, to simplify communication, we can use structured communication during sign off, like SPARK communication, situation, background, assessment, and recommendation. If we standardize this and we teach the team and we use it all the time, we're going to reduce the error during transitional zone. Also, simplification can be done by limiting the range of drug available for prescription, and also by restricting the dose. For example, if you are using different concentration of heparin in the ward, just limit that to one strength, and if you know the different one, you have to go through different process. To standardize common process and procedures throughout the hospital, if we standardize all common process, for example, we use the same prescription form, we use the same discharge form, and also standardizing the equipment. If we are using a machine, we should have that brand all over the hospital, so this will help the staff to operate well and not to depend on the memory to recall how to operate each device in different place and time. Applying human factors in workplace, routine use of checklists. The use of checklists has been successfully applied in many areas of human endeavors, such as studying, examination, traveling, and shopping. The use of surgical checklist developed by WHO is a common practice in many hospitals. Many procedures we can use different checklists for intubation and airway management, for central line placement, for quality indicator. These tend to improve the quality of care and at the same time maintain patient safety. Take home regarding human factors. Errors are inevitable even for healthcare provider. There are situations that can increase the likelihood and tendency to make error, some of them related to individuals, some of them related to the environment, and some of them related to the task. Attention to human factor principles can lead to reduction in errors and its consequences. Human factor engineering is about designing the workplace and equipment to accommodate the limitation of human performance.